Here, hopefully.
Oh, yeah.
Okay.
And it's even-
Okay.
We'll go ahead and call this meeting to order. We can start with a roll call, please.
Director Jeffries. Here. Director Leach.
I'm here.
Director Mraz.
Present.
Director Stanicek.
Here.
Thank you. We have quorum. Are we recording?
I think so.
Let me double check.
Bear with us here for a second, please.
Recording resumed. Okay.
Okay,
Make sure you're-
we'll start with the pledge. Will you please stand up? Another pledge right here, ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, can I have a motion to approve the agenda?
So moved. 1 second.
Any discussion? Good, seeing none.
Director Stanicek.
Aye.
Director Mraz.
Aye.
Director Leach.
Aye.
Director Jeffries.
Aye.
Thank you.
Okay, moving on to, consent items.
Public comment.
Oh, sorry, there we go. Public comment, do we have anybody in the public that would like to make any comments here to start out the meeting? Any, note cards or online?
No.
No?
I know you're looking at it on your phone, but you
Thank
can
you.
see it bigger that way.
Thank you. Awesome. If you guys have a comment later on during any of the agenda items, feel free to let me know and you guys can make your comments at that time. Moving on to, consent items. Can I have a motion to approve the, consent items?
So moved.
I'll second. Any discussion or would actually anybody like to pull any of these items? I should ask that first. No, I'd actually like to pull, if I could, I guess Teresa's not here, I'll pull, D7. We could, make a motion for the rest of the items. I'm going to approve all the D7. Thank you. Second, thank you.
Director Jeffries.
Aye.
Director Leach.
Aye.
Director Mraz.
Aye.
Director Stanicek.
Aye.
Thank you.
Awesome. So I was just hoping to pull D7. Obviously Rachel's been very busy. That report is pretty heavy and I thought it would be a good opportunity for you to kind of just let us know how everything's been going and
Sure.
kind of highlight some of those things going on there.
Sure.
So, thank you.
I won't run through all of them in detail because you've got them in your packet, but facility upgrades are continuing. Obviously, ADA ramps are probably the next big thing. We've started our planning meetings are obviously with SiteLogic for the solar infrastructure parking lot project. So that's all well and good. I'm gonna venture to guess what caught your eye was the clinical care option. Stephanie?
Yeah, absolutely. I like to see that.
Okay.
Yeah.
So obviously there's been a great interest in having more accessibility for clinical care in the district while we're still trying to figure out partnerships with additional urgent care or additional primary programs. Judith actually brought this one forward from Sesame, which is actually in partnership with Costco, something they're already doing. And what this would allow us to do is basically create a portal through Sesame for telemedicine. We don't have to serve any of the billing, any of those components. We just create that access point. We can set up a monitor and camera and everything in the small room here so that anyone who doesn't typically have access because they don't know how to access it via smartphone or don't have the system at home, they could come here. We could help walk them through signing up. And then they could have a telemedicine appointment with either primary or even certain specialty care. They pay directly through the Sesame portal, through those providers. All we would do is provide an access point, which is a good Band-Aid solution for bringing more clinical care in time. So. Question?
The more I think about comprehensive healthcare and rural suburb communities like ours, it's shaping up for me like a layered approach, where I'm so used to the doctor. When I was young, the doctor came to my house. He did house calls when I was a kid, well, that's gone. So it's more and more layered and discrete layers.
Mhm.
And what I like about this possibility is it is just what you said, a point of access for people who don't have a health home. And it's no harm in foul on us. And it is bilingual, if not
Yes.
trilingual in some cases.
Many language options.
Many language options. That's terrific. And it's a way for people to get started in having a health home, and then maybe that will encourage them to get a more comprehensive health home, et cetera, et cetera, et cetera. So I'm very interested in this. Plus, I love the name because I love Aladdin and Open Sesame. Remember that fairy tale? So we're opening up a world of gems to our community. So I think it's a swell idea.
Great.
Awesome, I agree.
Is there any type of compensation for us doing this, or is it a goodwill gesture to the community?
This is absolutely just goodwill. Yeah, because we don't have anything to do with the actual care or the billing, we would just make it accessible to the community.
What sort of options are we looking at for like a monitor and?
So we figure there's a few different things, primarily a monitor that could, or a camera monitor situation that could be movable up on a stand, so that if somebody came in and said, oh, you need to look at this thing on my leg, you can move the monitor.
Yeah, it's a monitor called Meet from
Okay.
Zoom, so they tie in very well together. It's just a push for somebody who's technologically, not very advanced, they just push the button. Video monitor hooks up to the appointment that we've helped create through Sesame with them. So
Okay,
they could just walk in and push the button, but it's something called Meet monitor.
Nice.
okay,
That's why there might be a small cost to it. We're gonna probably try it out with existing technology first,
Yeah,
just to see
if there's interest.
a pilot essentially, and then we'll invest in it if there's enough interest and it makes sense.
understood. I've seen, some of these setups where it has like blood pressure cuff and like some of that diagnostic equipment. Is that something that, we're looking at
I
or?
think the cost behind that may be a little prohibitive. I had looked at that. They did give me a few of those options. They say they don't necessarily have their practitioners utilize those.
Okay.
Yeah, so they didn't go down that rabbit, but that rabbit hole. Those are pretty hefty in price. So
Okay.
there are a couple in our community that they offer to allow us to look at. But not
Is it just like a
something
standalone machine that has the monitor and everything all connected, or how does that work?
for Sesame, like.
No, for the monitors that you're saying, like with the blood pressure.
Oh,
and all
yeah, it's basically one of those sit down, I think most of us have seen it at CVS Minute Clinics, where you sit down, you stick your hand in the arm cuff monitor, and it measures
Sure.
blood,
Yeah.
heart, and other things.
that. Okay,
There were some accuracy issues with those, so that's not the route that they recommended. They went straight telehealth with the Neat monitor and then just assessing the patient with either, clinical care through specialists or a variety of providers. And that's where we went into the cash pricing of everything. So there's no insurances involved. It's just cash price only to the patient who's interested.
okay. No, what, do you know what the cost is for them or?
So there's a menu of options.
Yeah.
Initially, we would kind of set the limits of, basically $40 to maybe $80.
Okay,
In theory, you could do it yourself without having to go through our portal at all. So if you wanted to spend $90 to see a specialist, you could do it yourself on your phone.
yeah,
The idea really is, because this is a Band-Aid option, really to just be able to serve those low-level services. We'll probably keep it to more general care, some general specialties.
Mhm.
So that should keep the cost at about the $40 to $80 range.
okay,
There's other options,
yeah,
but we'll see how this initial run. And we'll see how this works, and eventually we're hoping we'll have additional clinical partners with an actual brick and mortar.
Mhm.
So we want to make sure that we're not investing in something that's going to be obsolete in a relatively short amount of time.
sure.
Yeah.
Is the plan to, put it over there or here?
We actually figured that we would hold it here, since it really kind of requires somebody to kind of walk them through and maybe sign them up. We thought that we might be able to start it here. That way we can have fewer traffic, less clinical involved. That team is already pretty busy over there with services. So we thought we would start it over here and see how that works.
All right, well, yeah, I think I agree with Director Jeffries. It seems like a good opportunity. It seems like a lot of the next generation of healthcare is, like you say, it's a lot of different options. So the more people that we can touch or provide access to some of that, then doesn't hurt us. So yeah, I like the idea.
It's kind of similar to a mini clinic.
Similar, yeah, only it's all telemedicine.
Yeah, that's cool.
Yeah.
Yeah. Similar type services though, and yeah, it's the closest one we have is I think in Temecula, so.
Yeah.
This will be.
Yeah, I mean,
nice location.
The nice part is that for folks who maybe have insurance or even folks who don't have insurance, but for folks who aren't able to get into their practitioner because they're full.
Yeah.
And you're like, listen, it's the same psoriasis I get every year. I just need the ointment.
Yeah.
It's worth my $30 copay, $40 copay. Now I can do it through Sesame, like, oh yeah, look, see? We know that it's not gonna be high level. It's not super diagnostic. It shouldn't be. But it solves that immediate access need.
More layer of the onion.
Yeah.
Absolutely. Yeah, no, I mean, I know, now, a lot of I know my doctor, anytime I'm sick, it's like just call or do
Yeah.
Hi.
web appointment so that you don't have to come in.
Right.
Send in the-
That is my favorite.
Yeah,
Right.
for sure.
And that was one of the best parts about it is the prescription piece, when I tell them,
Yeah, just their ability to be able to call in a prescription to any local pharmacy, you know, two of the things they brought up is you can get appointments with them to be seen for something like she's mentioning, like a psoriasis, a pink eye within a couple hours. And so within a couple hours, you can have the doctor speak to you and call in a prescription to the local pharmacy of your choice.
Awesome.
yeah, it's great.
That sounds good. So,
All right.
uh,
And then, oh,
yeah,
I know it's not on there, but given the recent resignation of Director Brown, I thought it would be helpful, maybe if you could share and outline maybe the appointment process that we're scheduling for the board and for the public.
awesome.
So if you wouldn't mind taking just a moment to go through
Yeah.
that.
yeah, so, when Director Brown let us know that he was resigning the position, obviously, we talked about that at the last board meeting. We filed the notice of vacancy, so we've done all of those notification parts. The community, anyone who's interested for Zone 5, if you're interested in that zone, you just need to submit kind of a letter of interest to us, like, tell us you want to do this, right? And then generally it would be helpful if there's a resume or anything that explains kind of why you want to do this, maybe what some of your skill sets are. That then will come back to the board. That is actually scheduled at the April board meeting.
Yeah.
Yes. Trying to keep my facts straight, so that way we've got all of those dates aligned. Those applications would be due back to the district by the 18th of March. That gives the board enough time to look through any of those applications, set up a question and answer time for that April board meeting.
And I just wanted to make it clear that because Director Brown resigned prior to July 8th, which is 130 days from the November election, that the applicant would serve until the November election. So they would be in place, but they would have to apply in August the 88-day deadline in order to, if they want to seek. And that would be a 2-year term for that division as opposed to a 4-year term for the other divisions that are up.
So I basically serve out the remainder of.
Yeah, but they have to run for election to do that. If he had resigned post July 8th, after July 8th, then you could appoint somebody to serve the full term. But because it was so far in advance of the next election, and it really wasn't halfway through his term,
Yeah.
then under the code, you've got to run for that 2-year spot.
Understood.
And so in the old days, we used to be at large as opposed to divisions. And so when a director decided to run for office, in the case where we had a 2-year spot and then a couple of 4-year spots, then that was a little bit, you could choose. You could say, well, I'm going to just run for a 2-year term. But this is a specific division for a 2-year term, so I probably confused you enough,
Okay,
but
Jeff, so they'll fulfill this term.
yeah, they'll fulfill the
Then-
end until the
And then
November.
let me
10th
say it, so they fulfill the term, they can run in the November election,
Mhm.
right? For another 2-year term, for a
Yes.
2-year term.
For a 2-year
Okay,
term.
so they complete this Michigan, and then the election is for a 2-year term, not a 4-year term.
Yes,
Okay.
and they would, technically, the term that they would serve, if they decided not to run, for example, in November, would go through the first week in December is when that term actually would end. So, and whoever's elected in August would then serve that term.
Yeah.
And in the case, sometimes there aren't people running for that, so if they did file and nobody else opposed them,
Yeah.
then the Board of Supervisors will appoint you to the remaining term.
Okay? Very good.
Which ultimately means that the November election will have 3 seats on the ballot.
Yes.
So,
And we have 100 applicants at this point with the 18th coming up?
yeah, no.
Okay.
I have one person who's notified me of interest, but I don't have anything in writing from anybody.
So hopefully we'll get some.
Well, I appreciate that clarification. That's
Yeah.
good to know. I was kind of thinking it was gonna be, filling out the, remainder of the term.
Yeah, and I realized that might have some confusion, so I looked at it and made sure that confirmed that because it was before, it was more than 130 days out, that under the government code section that applies in this situation,
Yeah.
so that's actually the way it works.
Good, yeah, no,
Okay.
that seems like that makes
Yeah.
a lot of sense, right?
Yeah.
For sure, the election's coming up, so.
Yeah.
Go ahead and run for it.
Okay.
Awesome. Well, I hope we get more interest and, I would certainly encourage everybody out there to get out there, get out of the ring. It's a lot of fun.
And if you're not sure if you are in zone 5 of our district, you can go to the interactive map on our website, or just let me know and we'll pop in the address and we'll let you know what zone you're in. In case you weren't familiar. We don't really need to talk about grants. You've got your books there. I'm asking for those to be back to me, actually till April 4th. I wrote April 1st, but April 4th to get me your score sheets back. And then we'll go ahead and do the actual grant scoring award meeting at the April board meeting, which I believe is April 10th.
Yes.
April 10th. CPR training, we did our first one, or it's coming up, wait, it's coming up next week. We reached out to our grantees to let them know that we're offering the full CPR AED certification training. Our initial outreach to our grantees indicated about 80 interested participants.
Awesome.
But then as soon as we got it scheduled, only 23 signed up. So, I'm gonna reach back out to the grantees and find out if, kind of what that chance was, if it just happened to fall on bad days or whatever. So we'll reach out to them and continue on that. But what was nice is that the vendor that we found that does the CPR training also can do a full AED assessment. So anyone who's got their AED can pull it out of their cabinet, bring it forward, and the vendor can help go through and make sure that the pads are correct, that the battery is correct, and really kind of walk folks through on how the system works again. So, and I know that had been part of our conversation from strategic planning,
Oh,
so.
yeah, absolutely. Good
So
deal.
bringing that forward, we're also still researching what it would take to have one of our own team members be able to offer that CPR certification class. So that if there is a community member that wants more than the sidewalk CPR, or the hands-only CPR classes that North County Fire has been providing, that we'll have another option for that. So we're still researching what that looks like.
Awesome. Good deal.
Really, only other takeaways, obviously, I was appointed to the ACHD board. So I went up to that first board meeting in late February. How is that already that long ago? Really, most of our conversation had to do about really working towards advocacy. ACHD has gone through a pretty nice reevaluation of who they are, and they have added several new health districts to their roster. And so they're doing a lot more work around legislation that's not just the hospital-based, But the overall rules that, Sacramento are considering for some of the minimum wage conversations that are going through with budget, and a number of different things. So as we get farther into that, anything that looks like it's going to affect us directly and or our region, I'll bring that back to the meetings as well.
Awesome. Congratulations.
Yes,
Thank you.
congratulations.
It's very interesting stuff, sitting there with some of the different sized, districts.
Yeah.
What they're doing.
Yeah, it's always good to hear ideas from outside sources and see what everybody's doing for sure.
Yeah, and then the only admin projects that are still going on is, I'm bugging Jeff constantly, he knows this. For our updated policy manual, he's got a big project, to look at on that. We're not bugging him too much because we know he's got a couple of small projects he's got to finish. And then the updated employee handbook, there are several new HR policies that Judith and I have been working on. I've sent a couple to Jeff and then we'll bring a couple back. Just to make sure that we're absolutely following current standards and practices. One nice thing that is going to be able to support the district is Judith is going for actually 2 different HR certifications, one through SHRM, Society for Human Resource Management, which is basic HR, right? And then the other one is the public employee,
Public. PSHR, I don't remember.
PHSR, yeah,
Yeah.
there's too many acronyms. But that one would really be able to focus more on public employees. And that's where sometimes we see those distinctions, and obviously Jeff knows that pretty well. But it's nice to have that in-house as we've seen the growth in our staff. It's important that we are more professional in how we're handling a lot of our employee things. So you'll be seeing more of those policy upgrades brought to you in the next couple of months. But those are big projects that we're working on in-house.
Awesome. Very good, thank you. Any questions?
I have one. I don't want to open a can of worms, but I would like to make the suggestion as we move forward, if we, as a district, are faced with a new outbreak of some sort, whatever it is, whatever you want to call it, disease X or monkeypox or whatever the heck is, can we be in a position to let each individual person make their own medical choices and not be in a position to mandate any kind of vaccines for any of our employees or staff?
We never were in a mandated position here. So we followed all of the state requirements, but there were never any specific mandates that we had to change any policy for here.
Excellent.
Yeah.
Thank you.
Well, I definitely support that, so good deal. Glad that we're, ahead of stuff like that, and thinking ahead. I would just make a motion to approve D7.
Second.
Any discussion?
Ready?
Yeah.
Director Jeffries.
Aye.
Director Leach.
Aye.
Director Morales.
Aye.
Director Stanisek.
Aye.
Thank you.
All right, moving to discussion and possible action items. We have E1, it's the review of the Michelle's Place Cancer Resource Center, MOU.
Yeah, this is the one we discussed at the last meeting that the wrong one had been put in the packet. So this is the updated one. Again, it's really nothing new from what we last discussed. It just has more of the detail about the specific program requirements that they would bring forward as part of that agreement. Again, you see it as grant language. And again, that's our requirement for anytime public monies are distributed out through grant language. But this is the contract agreement. And basically it expands what they had been doing through the grant process. But it would have a more permanent and a lot more flexibility on the kind of services that they can bring forward based on what the team sees as community need. So.
Awesome. Any public comments on this item? Seeing none, any questions, comments from the board? Director Jeffries?
I like the continuity of the MOU and I like the predictability for the agency.
Yeah.
So it's kind of a perfect kind of thing for me.
Yeah, absolutely.
Yeah, at what point does a potential, I'm gonna say deviation, but a change that gets dramatic enough where we would have to make some discussion around that? Is that
If,
something they raise with you and then we have a we try to figure out where that falls, or is that just?
I think it would really depend on what dramatic gets defined as. So let's say they,
Yeah, who knows? right?
yeah, they want to, renegotiate cost, obviously that comes back completely. If it was, they're going to no longer have a navigator come out to the site at all, that's a dramatic change. So they would have to bring that to me. We would bring that to the board and say, listen, it's not working. We have a, a quit clause. We could go from there, but,
Pose some guardrails and then.
oh yeah,
Figure it out from there. Okay.
yeah.
Yeah, I think it's a great example of what we're trying to do with some of these more long-term programs. Like you say, we want to be able to give our partners, the predictability of what to expect. And, I think it gives us the opportunity to lock in ourselves on a great program that's helping out the community. So, I'm totally in favor of that. I would make a motion to approve the MOU as presented.
I'll second that.
Any other discussion?
Director Stanica?
Aye.
Director Morales?
Aye.
Director Leach?
Aye.
Director Jeffrey?
Aye.
Thank you.
Next we have E2. It's the review draft of our strategic plan. So this is just basically we had that strategic planning meeting. Rachel basically kind of put together some of our thoughts and ideas here and into I guess a first draft document. So Rachel, I don't know if you have anything on that before we kind of.
Yeah, well, obviously the format is really kind of, not settled. It was really basically to boil down the conversations. There's some things in here, obviously, that reflect, our conversations that won't go forward as far as the permanent plan. So we just wanted to make sure this came back to you. You had a chance to look at the notes. And then we'll take this back to strategic planning and we'll just outline a set of strategic initiatives, those bullet points, that are a little bit more, decision specific. And then from that, we'll have a little bit more detail on implementation plan once I meet with the team on how we plan to carry it out. And then that will be what we'll report on towards that goal as far as our format. Great.
Yeah, no, that sounds good to me. I think that it seems like a plan, kind of, we can kind of just take a look at this as it's presented. And if you guys have any thoughts as far as if we missed anything or if there's anything that we needed to add to that came from the discussion, but I think it's pretty comprehensive. I agree, we probably need to format it a little different and kind of just organize it a little bit more concisely, I guess, but I think that it basically kind of reflects the discussion that we had.
Yeah.
So.
Yeah, so obviously, it's mostly the notes and the main takeaways from that planning
Yes.
session. And then some of the things that were clarifications, we'll remove that from the plan because that doesn't really matter. But we'll talk about specific programming, the process of how it's brought forward to the board, how we discuss it. And then there were certain plans or programs that the board expressed interest in, primarily the CPR AED program. And then obviously there was some opioid harm reduction education information. We already had the team working on that, so we'll just crystallize that a little bit more as a strategic priority. And then we'll start to outline the implementation from that, and then we'll report on those specifically. And then obviously there's that whole subsection, which is really about development at the center, the ADA compliance, working towards certification as a cooling center, those kinds of pieces.
Yeah, awesome.
Are there key checkpoints that should be added here for the parking lot and solar project? That's some key milestone somewhere?
No, excuse me, not in the strategic plan.
So you're
In-
considering that a very short term?
That's a very short term, very discrete plan. Those goals and those those timelines get kicked to facilities. And then facilities discusses them there. And then if there's any challenges, deviations, updates, I'll put them also in my report so that you can see them there as well.
So it's more, there's work being done there though, so how does that get balanced against these items? I mean, is there,
Because that's already been an approved strategic initiative, if you will.
right?
There's no really reason to consider it as part of the plan because it's already,
So another way of
It's already
saying that is the program management of that is absorbed into the work plan that's represented by the 3 to 5 year goals here that can be covered.
Yeah.
Okay, that's, okay.
Yeah.
Make sure we're not creating a gap in the future here.
no,
Resource
no.
gap.
Yeah, and that's part of that development part, which are more task specific.
Yep.
Yeah.
Well, and I can verify if I may.
Absolutely.
I can verify that we're underway because I just signed $131,000 check
Awesome.
to site, so that's, I view that as a good thing. They're
Good.
moving.
Yeah.
They're
Yeah.
moving, so somebody else will be signing that too. Because it
That would be
requires
Barbara.
2 checks. Two.
Yeah. So at
Barbara,
this,
you get to sign it too.
yeah, and at this point, because we know, just as a side note, add on to this, you know, with the fact that the board will be short term, and Mike, we know that you're not gonna run for your seat in November. To go through all the signer cards to add you for just a few months, we've chosen not to pretty much go that route.
Yep.
We've gotten to, completely local, active, easy, very amenable, signers.
One less thing you have to.
You're not gonna have a signature.
He's
card.
not, girl.
I'll get over it pretty soon.
Okay, good.
He's already over. So we figured that we would just leave the signing with the two of you at this point. Obviously, if something dramatic happened immediately, we know that we can work with our banking institutions. So,
Will be a busy woman, won't you? Got a lot going on.
Extra ink in the pen.
Yeah.
I want to echo your comments too. I think the next level of detail is, would be very helpful just to, it blows through the staff and making sure we've got everything covered here.
Yeah.
Yeah, that's the next step. So it's all good.
yeah. So we'll kick these main priorities over to strategic planning. Strategic planning will say, this is how we want it listed out.
Right.
And then from there, we'll bring implementation or details on how we're doing it through that committee and then up to the board.
Excellent. Good work.
Yeah, no, I think, when you look at the goals that we have in this strategic plan, kind of coupled with where we've come from having an empty hospital building and kind of moving into that, I mean, I think that it's very impressive, kind of the transformation that we've made as a district from what we did to what we're doing in the future. So it's really a testament to the staff and to Rachel about where we're going. So I really like to look at that strategic plan. I'm excited to see it come to fruition. So yeah, I'm not sure if we need to do anything else to that or.
No, again, it was mostly just a review, so we'll kick that back to strategic planning. I know the March meeting date wasn't working, so we can plan something to kick off in early April if you want to try and do a follow-up. And then, or we can just wait and I can clean up a little bit more and we can wait till the end of April for that one. But we can talk about
Whatever
that.
works for you. What do we have? The meetings on the 10th.
Yeah, before April 10th, I think it's gonna be rough since you guys are gonna be pretty busy with the grant stuff.
I would say, yeah, maybe just do the regular meeting
Yeah.
in April and we can kind of chat offline or whatever
Okay.
about some of that or whatever. But I think that we're definitely kind of headed in the right direction with it. I mean, I think that that's, like I said, it kind of encapsulates a lot of the discussion that we had and a lot of the goals that we have as a board. So for sure.
Yeah.
Alrighty. Well,
Yeah, just to share with you on the role of the foundation and the idea that increase access to county, state, and federal funding options. Just to give you an example, the Desert Healthcare District up in the Coachella Valley, it represents about 500,000 residents. And there's a lot of Hispanic workers up there. And during the COVID situation, the county had a grant basically from the federal government. And they set up with partnering throughout all, I mean, there was CVS, I mean, I can't tell you all kinds of organizations, nonprofit organizations in the community that they coordinated with. And the county said it was easier, they had to have under the federal rules, they had to have a nonprofit sort of administer this. And so they chose, they felt that because the foundation, the district foundation served the whole community, they decided that they would basically have the foundation run this program. And part of that was it did take a few extra people at the district to run it, to help coordinate it. And so administrative fees were paid for through this grant for the district personnel. And I believe they served over 50,000 COVID vaccinations. And there were over 50,000 tests done. I mean, it was just a remarkable program that for people that didn't have access to as easy access as a lot of other folks. And so, you know, they have a little video on it, and it's really it's a really remarkable program, and it was all done because they were in a position to have a foundation to do this.
Yeah.
Now, that's not to suggest that, you know, that's gonna happen here, but there could potentially be opportunities, particularly through federal grant monies, that they utilize the foundation, so. You know.
Yeah, it's helpful that the Deserts Foundation has been up and running for a long time, so
Yes,
it had a good system and process in place.
yeah, and they had, I mean, that goes back many years, and it was a fairly well-funded foundation. Even when it was the district's foundation, but when the district board took over the operation or the oversight of it, it had, you know, quite a bit of revenues that were coming in from donations and things like that. So they had a little, in fairness, they had a little better start than we've got.
And they were also operating a hands-on hospital, correct?
No, they were just like us.
Oh, really?
Yeah.
They don't operate a hospital. They just simply are a P2, what we call P2s. They're simply a district that has leased its hospital and is no longer operating a hospital. So.
Excellent. Yeah, and I've always thought that having that opportunity to get some of those grants would be you know, putting ourselves in a really good position, and with some of Rachel's experience.
Yeah,
Yeah. Spot on. I mean, sometimes there's definitely some money out there that would be great for us to bring into our community, and it
Yeah.
doesn't do us any harm for being able to
Yeah.
be set up to be able
I
to
mean,
receive that.
They got a lot of really favorable publicity for the program, and they use a lot of community organizations to help implement it.
Awesome.
Well, and I mean, that has been our goal through our grant program here, is really making sure that our grantees and the district are strong partners together. The Wellness Center is the ideal hub for that. So as those state or federal grant dollars become available, and we have this collaborative group that can come forward to apply for it, we're the fiscal agent, we've got these partners to bring it forward. Now we can serve an entire community where no one nonprofit would have had really the ability to access those funds.
Yeah.
So it really does set us up for future things that don't always have to be disaster related.
Right.
Yeah. And it's, you know, it's kind of interesting because these federal programs, they look to, you know, nonprofit fiscal agents. They don't look to the county to do it. The county can be a pass-through. But they really, you know, they look at it, they don't necessarily want local governments administering it.
Yeah.
Awesome. And yeah, I think it's extra important just for us, just because of the geographic location. Anything that does go through the county isn't gonna necessarily come
Right.
here in the same proportion. So for us to be able to give things like that to the community, I think that's huge for sure.
Yeah. Well,
So,
I mean, we're seeing such a huge influx of visitors out at the center. There's a ton of interest between the diabetes program, and I'll give the most recent example, which all of us nearly dropped our jaws. The county funded a Tai Chi for Balance program, and we had our own opportunity to offer it here at the center. And it's, a county is paying for this program to happen. We're gonna have it on our site. So as soon as we opened it up for registration, it was filled. And when we end up with 38 people signed up for this thing, that's beyond our capacity to serve. So we actually had to limit how many of those people could attend and create a wait list
Wow.
for that one little tiny program. So you can imagine how much more capacity we could serve if we could bring some of those dollars to us
Yeah,
and not have to be reliant on what the county is gonna make available.
yeah.
So.
It'd be nice to get a program like that, outside, at some point. That would be a.
Yeah, we actually had a conversation about where, the ideal spot would be for that. And, you know, we've got that great spot just outside of the house area underneath those big mature oak trees.
Yeah.
Great. We gotta clean up some trees and some leaf litter and make sure nobody falls in gopher holes and such and things, but we,
Yeah.
we'll get there.
Tai Chi for balance.
It's fine. Right, we just gotta make sure nobody falls down before they get there. So it's a lot of great opportunity. So we're just trying to make sure that we can keep up with the pace of it. And then obviously, you know, it takes staff to oversee it, to organize it, to make sure the facility is appropriate for it, but the potential is there and we're just now tapping into the bulk of it.
Is that a option in the strategic plan bullet 3.5 here to say outdoor space enhancement program or something just to capture that?
You know what,
You have success like that?
I don't think we need to worry about that just yet. I would say that we'll build that in as part of our ongoing, as each year we add different pieces. Again, because there's so much of the development of the center that is task and specific and time. I think we just bring it forward as it comes available. And then if there's a space availability to make a change to the space, we just get it done. I know that Teresa has already spoken with North Coast Church, potentially to have us be a site for their day of service where they may be able to come out and do a lot of that tree cleanup and stuff. So we're just pursuing all of them as they come forward.
Yeah, well, I think, some of that piece is probably in the, becoming ADA compliant as well. I don't know if like some of that area is probably not very accessible
It's
now.
not at all, yeah.
So I'm sure if we're ADA compliant and people can get over there, that's probably at least half the battle.
That's part of that house, that back area, making sure that that's available. So that would fall to some of that.
Got it.
For sure.
Awesome. Good deal. Anything else from, E2 or? No? Do we have any, board member comments or any items for subsequent meetings?
I'd just like to, Mike and I know this, but I figured I'd put you two into the finance committee for that. Not only do we have an appointment coming up and our grants, but the timeline for the 24-25 budget is we will receive a draft at the April meeting. We will have our public hearing in May, and we will have the approval in June. Quick step, speaking of dancing. So, it's gonna be a busy 3 months.
Thank you. I appreciate that.
Yeah.
I'm getting over sick now, so I can be healthy.
Just for me, just on that note, the budget coming up, we have these, so I would just urge, the other board members and myself, just a reminder, just really do the homework on these grants. The more, questions that we ask early on in the process, the more we can get good answers and we can find, Rachel could potentially ask for us something, if there's some clarity that we need. And let's try to make sure that we get those, scoring sheets in on time.
Michael, I'm in a meeting.
Hi there.
I'm in a meeting. I'll have to go in there.
I'm sorry. Talk to you later.
Bye.
Apologize.
No worries. Like I said, there's a lot in here. I would just say like, in previous years, some of the grants are written in a very easy way to understand and some aren't. So, do the best that you can at trying to figure it out and, but I think that at the end of the day, when we look through this, there's a lot of good that can come of that in some of the programs. So let's all just kind of take our time and see what we got. And especially since that we're basically rolling this grant scoring deal into a regular meeting. The more that we know about these grants, the better, so that we can come in here and kind of hash out like what we think is viable or works or is worth it for us to move forward with. So,
And if you don't mind, I'll just recap the process if you don't mind.
yeah, absolutely.
We'll follow kind of what we've done over the last few years. When we did our iterator reliability training, the ideas on your scoring from 1 to 5. 3 is just your normal standard. It just meets it. 2 is it is subpar. 4 or 5 is it is something exceptional and above and beyond just meets the criteria. So keep that in mind when you're doing your scoring. And then what we'll do, and we've done this the last couple of years, is you'll all provide your scores back to me. I will then blind them and we'll take the averages and you'll see. Then we'll take there's 23 applications. We'll take the top third, the middle third, and the bottom third, and I'll kind of rank them in that order. That way, when it comes back to you to look forward to for your April board meeting, you'll be able to see, here's where you had consensus, you all generally agreed. Here's where you mostly agreed, and here's where you may all agree that you didn't want to fund, or where there's the most variability, something like that. So when we get to that April meeting, your top scores, you've already all likely 100% agreed. So it may not require a lot of conversation. You may choose just to just pull 1 or 2 or have more conversation from that middle zone or lower zone, depending. But to Director Leach's point, if you have questions on something where you don't feel they've answered it or you don't understand the agency enough, reach out to me. I may be able to provide you more background information, or I may then have enough time to go to a grantee and say, a board member had a question about this information. Can you clarify for me? Obviously, it's not for them to be able to rewrite, be able to provide more information, but there may have been something that was left out of the application or that wasn't clear. You can send that information out to me, and then obviously I would send that out to everyone so that there's clarity on that. But the expectation is you've got all that information before we go into the grant meeting.
Are we gonna see the blind before the board meeting?
Yeah, so before the board meeting, you'll have that score sheet
Yeah.
that'll have everyone's final rankings on that. You'll get that as part of your board packet or earlier, as soon as I can,
Okay.
get all your score sheets back.
Got it.
And could you remind us, as we take our notes, refresh our memory on that?
Yeah, so you'll have a score sheet on there, and then there's a separate page in there that you can write any of your notes
That's right.
on that application, on that section. And I actually added it out a little bit this time so that it says question 6, 7, 8, whatever it is. You can put your question, your note, your comment right there, so that when you're in dialogue with one another, you may want to be able to say, hey, I noticed on question 8, they said this, I really liked it, or I didn't understand, or what's your opinion, something of that sort. So that it should be fairly easy for you to be able to just bring your packet. And again, when you give us the score sheets, Raquel and I will be very quick. We will make copies of all of them and give you your score sheet back so that you'll know what your score was, so that you can come in fresh and ready for that conversation.
I see the improvements already. Thank
You
you.
see that? Yeah. Well, and that built on what we've done the last
Right.
couple of years. So.
Great, thank you.
Just, do you have a question?
No.
Okay, just a quick question. The grants from last year, where can we find the impact reports? Are those on?
All of it is on the website.
Okay.
Yeah, actually, I think Q2 was the final one, last one we got.
Yes.
All of that is already on the website.
Okay.
Q3 grant reports are due in April. We always post those to the website as soon as we get them.
Okay.
That way you can see them at any time. So those that are consistent,
Yeah.
you'll be able to go back and look at their impact report there.
Can you, maybe, somebody just send out a link to the board?
I'll take care of that.
You
I
got that?
appreciate that. That'd be good. And then that way, if you guys have any questions about some of the repeat grants and how they performed in the past year, we can kind of go back and look at the.
It's actually the last 2 years. The year before that are still listed on there as well. There's a accordion file on the website. You click it, it'll show all of the previous year.
Awesome.
Same with this year.
Good deal. So we should be able to have an idea of how these grants are working out and have an idea of where we're at on those. So we should be in a good place with all that data. So thank you. Anything else? Seeing nothing else, we have a couple committee meetings here listed. And then that next board of directors meeting. I also wanted to mention, it's not on here, but also I believe it's April 10th is that ambulance.
Yeah, that just went out to you all today. So if you haven't seen your email yet, I met with Chief McReynolds and Chief, I don't know what McMillan's official title is, the new Kevin Marr, Brian McMillan. So I met with Keith and Brian today. And they will be having their new ambulance in service ceremony on April 10th, the morning of our board meeting. And just trying to schedule when their board was available and you all are available. I know it's a daytime that's difficult, obviously.
I think I'll come out. I think,
Okay.
I'll take that day off and just come in for that.
It'd be great because then they want to be able to do it, just a nice ceremony, since obviously we really are an integral part of having those ambulances in service. And this is their 4th ambulance that they'll be bringing in, so.
Great.
We also will have them, I also have them scheduled for May. May, we'll have them come back and present to us on a lot of their call volume and such. We did that last year, and I think that was helpful for you to be able to see that. There's gonna be some more conversation coming back around discussion for their grant ambulance support. That one is under discussion right now, as well as the potential for a different conversation. So that'll be coming forward as well in May.
Alrighty, well, at that point, we'll just go ahead and adjourn the meeting. Appreciate it, everyone.
Everybody for coming.
Good to have a full house.
Yeah.
I hope you have a wonderful vacation. Thank you, turn to us.